cold test is the most common test we do to determine the status of the nerve in your tooth. If your tooth responds to cold, that means it's alive. If your tooth responds to cold and it's alive, it cannot by definition be infected. It isn't infected. It isn't dead. So once you determine that your tooth is alive, then it's important to determine where the communication is occurring to the center of your tooth, where the pulp and the nerve is. You might know, obviously, you might already know you have a cavity in the tooth. So if that's the case, then you know you have to take care of it right away. Anyway, this is how you do a cold test. This is how we do a cold test in the office. It's a very standard thing, and you can get dry ice in a can off Amazon or the hardware store, or they have dry ice in a can. Literally, we use dry ice in a can. And we take a cotton roll and we spray it. We spray it, make the cotton roll really cold, and we press it on your tooth like that. And you can use, on the tooth in question, right? If you want, you can use a healthy tooth to see what's normal. We call that a control. We use a control tooth first. We'll go, okay, well, we know this one doesn't have a cavity. Well, how does that feel? And we press it. We spray dry ice. Ooh, I felt that. That's normal. As soon as you take it off, it should go away. This one has a cavity, let's say. And then, ooh, I felt that. That is good. That's good. If you have a tooth sensitivity problem and you go to the dentist, I'm sure you've had this test done on you before. That's what we're doing. We're using literally dry ice and making a piece of cotton cold. At home, you can, if you can't access a little can of dry ice anywhere, you could just use an ice cube. You could take the ice cube. If you get little ice, like those little ice trays, you could buy ice trays, and you can get those ice trays that make tiny pieces of ice. Or if you have crushed ice in your refrigerator, you just take a fragment of it, and take that and try to make it accurate. It's hard to make it accurate with an actual piece of ice. But if you also want, you can try to take some Q-tips at home and make them cold. Either stick them in a little ice cube tray and keep them in the freezer for a little while. Make sure it gets really cold and use that as your test. But as soon as you determine that you have vitality in your tooth, then you should take action to correct the communication that's there. You either need your cavity fixed, a filling replaced because there might be an opening in it, right? Those are two main reasons why your tooth can get sensitive to cold. The third reason is gum recession.